In this video, we are going to look at CPT code 99203 of a new patient, low medical decision making. So again, we look at the problem addressed for a 99203, and that is going to be two or more self-limited problems or one stable chronic illness or one acute uncomplicated illness or injury. If we look at the data is going to be limited. So it could be a review of labs or tests, any notes or ordering of tests. And the risk is going to be low, a low risk of complications or morbidity. So let's give an example of what a 99203 would look like. Again, this is a new patient. So the chief complaint would be maybe a patient presents for an evaluation of fatigue and intermittent headaches over the past month. Now the history is the fatigue has been worsening over the last 3 to 4 weeks, and the headache occurs 2 to 3 times per week, sometimes dull in the occipital area of the head. They deny any type of visual changes, they deny any nausea, and there are no neurologic symptoms. So the patient has a history of mild asthma, well controlled. There's no psychiatric history, and there's no current medications. So on my exam, I noticed that the vitals are stable, the patient is alert, they're not in distress, everything is intact, and the lungs are clear to osculate. So on my assessment, they subjectively say that they're fatigued and possible sleep hygiene issues I have noted. The headaches are likely tension type, and I order a CBC, TSH, and a CMP. I discussed with the patient their sleep habits, and I recommended improving their sleep hygiene. I also recommend a trial of over-the-counter acetaminophen or Tylenol as needed, and then return in 2 weeks to review the labs. So if we look at that presentation, that is justification for a 99203 when we are looking at a medical decision model. So there are two problems addressed, fatigue and headache, and they're uncomplicated. The data that I reviewed would be the labs. There's a CBC, a CMP, and a TSH that I ordered. And then the risk is low, and there's no new prescriptions. So that is an example of a 99203.